This is part of a frontline trial we have with 400 patients. From a long time ago, the LEN doses were based on healthy volunteers with renal failure, and it ended up with a very strict reducing dose schedule in the different levels of renal function. And that has led to people with newly diagnosed myeloma with renal failure, which are a bad prognostic group. They really need urgent treatment to reduce their light chains. They get insufficient treatment because of this very strict then reducing doses, according to the SMPC. In 2018, the Mayo Clinic published in relapse myeloma that you can give much higher doses of LEN in these patients without any problems, without any tolerance problems. So in our frontline trial, which has a sort of different agenda, we used these doses. So we used 25 milligrams daily, the standard dose, down to an eGFR of 30. And then below 30, even in dialysis, we included patients with all kinds of renal failures in this trial. We used 50 milligrams daily instead of a very low dose, which is in the SMPC. What we have showed in this study is that this is perfectly tolerable. The renal response is much bigger than what has been seen in LEN studies with renal failure. So I think it's a quite big population, so I think we sort of can conclude that we should actually adapt these higher doses of LEN in the frontline renal failure patients, and it's important for them to get a renal response quick, and it will probably affect their prognosis in the long run. But we're not sort of investigating that, we're just investigating the tolerance and the renal response, and that looks really well in this study.